My laptop. Hi, guys. I always leave my other laptop at the last minute. I always think I'm ready for my lives, and I'm not ready. Hello, Facebook. Hello, YouTube. It's good to see you. Happy Monday evening. Getting a low battery signal that I just need to get rid of. Hi. It's good to see you guys. I am just getting home from the office, and we're going to talk about a topic today that I actually spent a lot of time today talking about with my patients, which is acid reflux and ways to help symptoms of acid reflux. That's right. So I'm really excited to see all of you guys. We're also live on YouTube as well. Hello, Facebook. It's good to see you. I'm Dr. Jen Caudle. I'm a practicing family physician. I'm also an on-air health expert and video creator. I do daily videos and all sorts of health topics. You guys know this. Many of you might be new to my channel. I'm so glad that you're here. Make sure you check me out on YouTube. If you're not there, I'm at Dr. Jen Caudle. If you're not on Facebook, make sure you come on over to Facebook because there's stuff in both places. So let's get started. Okay. This is a topic I've been wanting to talk about, but today was the day that I was like, we have got to talk about this right now. Because I talked to so many patients about acid reflux today. So let's just jump right in. Now, the title of this is Natural Remedies for Acid Reflux Symptoms. We're going to talk about foods. We're going to talk about other things to help acid reflux symptoms. Okay, now you're probably saying, well, what's the deal with acid reflux? I've heard about it. Is that GERD? Is that heartburn? What's the deal? And by the way, there are a lot of people that have acid reflux or heartburn, gastroesophageal reflux disease, some version of it, okay? Acid reflux, just so that we're all on the same page, okay? Just so we level set here. Acid reflux is when the acid from the stomach, which by the way is supposed to kind of stay in the stomach, refluxes back, which means it goes backwards into the esophagus. It's not supposed to go there, but it does. There's a number of reasons why it can end up there, kind of refluxing back. That's what we mean when we say acid reflux, okay? And when we have acid reflux, it can cause a number of symptoms, okay? So that's acid reflux, gastroesophageal reflux. That's kind of the same thing, okay? And that's when the acid doesn't stay in the stomach, it goes to the esophagus. All right. Now, if you have acid reflux, you may have some symptoms that then tells you you've got acid reflux, okay? Now, I'm curious to know, I'm going to start looking at the comments just to see what you guys are writing, but write in the comments if you have acid reflux. Let me know if you do, if you want to share. If you don't want to share, that's okay too. But what symptoms do you get? What symptoms let you know that you're having acid reflux or like a flare-up or your acid reflux is being aggravated? What types of things are happening with you? And I'm going to pull up the comments so I can kind of follow along and see what's what. Let's see here. So let me see what we've got. Okay. So let's talk about some of these symptoms because some of you might be saying, well, how would I know if I have acid reflux? Well, sometimes it's silent, which means that you may have acid reflux and not even know it because maybe you don't have any symptoms. However, some common symptoms are, heartburn. That sort of burning in your chest. I know you guys have heard the word heartburn. You've seen the commercials on TV, and it literally is kind of what it sounds like. Well, it's not your heart burning, okay? But it's this idea that you feel a burning in your chest. And that's often what people refer to as heartburn. But can be other symptoms that people have that indicate that they have acid reflux, right? You can have a dry cough. You can have a worsening of your asthma symptoms. You can actually have like a sour taste in the back of your throat or the sensation that something's back in your throat. Some people have trouble swallowing or like what they feel is like a little bit of recurge, like okay, that's gross, but you know what I'm trying to say. And I've had patients literally with all of these that they literally feel like they're going to vomit up contents. And it kind of has that sort of sour taste. And some people that just have heartburn. Now, let me stop right here because y'all know I'm your friendly family doc. However, I'm not your doctor, okay? And I must say at this juncture, and as always, you have to see your doctor about any symptoms you have. And one of the reasons why, well, number one, it's because that's just the right thing to do. And your doctor knows you and can see you and treat you and make sure that you're safe and healthy. The other thing is that sometimes what may feel like heartburn may actually be something more serious. Okay. We don't want your heartburn to actually be chest pain, like from the heart. I'm just giving you an example. So this is for you and your doctor to work out. You can just say, I heard this lady on the Facebook, on the Googler Schmoogler, and she was talking about heartburn, doc, and this is what she said. But take this to your doctor so that your doctor can say, thumbs up, or I don't know, but this stuff is right. I'm telling you, what I'm telling you is right. But your doctor has got to help you make your diagnosis. Don't you diagnose yourself. These tips and this information is to give you some ideas that, and what I see really is sometimes a lot of people suffer in silence, don't even realize that what they're experiencing, they don't have to, or that there's something that can be done about it. So that's what this is for. Make sure you see your doctor. Okay. Now, so those are some of the symptoms that can be indicators of gastroesophageal reflux. Remember, reflux is like when the acid in the stomach goes to the esophagus. It's not supposed to go there. It's not supposed to hang out there, but sometimes it does. So you can get those symptoms, okay? Now, let's get to the good stuff, y'all. And I know y'all like, yes, natural, bring it on. Because, who doesn't like to be able to treat things naturally? You guys tell me all the time. You want natural remedies. You want natural solutions. What can you do without medications? And the fortunate thing is that there are many conditions where we can do a lot of things naturally, either to prevent conditions from coming on or to treat them or help them or make them better. This, if you truly have gastroesophageal reflux, and by the way, gastroesophageal reflux disease is when you have heartburn symptoms and symptoms of reflux more than twice a week, right? This is one of those things that if you truly have that, you may be able to help it / prevent it / fix it without medications. It is possible. It is possible for some people. Okay, so you say, well, what foods? This is literally what I was saying today in the office. Foods that aggravate acid reflux symptoms. Okay, let's start. Alcohol. Absolutely. Hands down, alcohol can exacerbate or aggravate acid reflux, bring on symptoms. Spicy foods, yes. Think about your diet. Think about when you feel like you have acid reflux symptoms. Think about, is it after you eat, which by the way it is for a lot of people? Is it, when you lay down to go to sleep, which by the way it is for a lot of people? And then think about what you've been eating. Spicy foods is huge, okay? Chocolate. Yeah, I know. Bummer. It's a bummer, isn't it? It's a bummer. But chocolate can exacerbate the symptoms of acid reflux. Okay. Acidic foods. Yes. This is something that a lot of people don't think about. So citrus stuff, fruity stuff, pineapple-y stuff, lemony stuff. I'm already like, my mouth is already like, you know, that natural reflex that like my mouth is all like, that natural sensation that happens when you think about like lemons, like your salivary glands start like literally secreting like liquid. And I'm like, so anyway, citrus stuff, okay, can exacerbate symptoms. Tomatoes. So many of my patients, and think about this, after they have pizza night, after they have pasta night, after they eat tomato sauce or something with tomatoes in it, may feel an exacerbation of symptoms. Think about that, okay? Coffee. I know that's a bummer for a lot of folks out there, but coffee, classic. Okay. I'm still going down my list. And I know you guys are probably like, well, shit, that's everything in the world. What can I eat? Well, hold on. Caffeine. Okay. So it's not just coffee, but things like soda, tea even can exacerbate acid reflux symptoms for many people. High fat content food. So like if you like just go crazy at McDonald's, or you're like, okay, it's a Popeye's chicken day. Okay. By the way, brands, I'm not talking bad about you, but I'm just saying, wherever you choose to go, and if you get a really super high fat meal, that may exacerbate symptoms of acid reflux. Mint. Yes. I have had patients over the years that eat a lot of mints, whether it's peppermints, so there are people that keep mints in their pockets or their purse or whatever. Mint or minty things can actually exacerbate acid reflux. And then one or two rather of my favorite, which is garlic and onions. Yes, I love garlic. I love onions, but this can exacerbate acid reflux for a lot of people. Okay. So, guys, keep this in mind when we talk about ways to sort of improve the symptoms of acid reflux. Oh, Vernon, you said smoking. Yeah, beat me to it. I'm getting there. I am getting there, Vernon Jones. Thank you for that, because we are coming up to that. I love, love, love you. You guys are on it. You guys are saying tomato sauce. You're telling it like it is. What is tomato sauce and barbecue sauce? Rhonda, you're saying is yours. Yeah, beef. I guess depending on how you cook your beef, of course. So, Tracy, you're saying pizza can do it. So these are foods that I have patients that have a true diagnosis of gastroesophageal reflux disease or acid reflux. And once they make what we call some lifestyle changes, including how they eat, their symptoms are lessened dramatically many times, okay, without medications, but their symptoms are lessened. Now, remember, this requires a proper diagnosis of gastroesophageal reflux disease or gastroesophageal reflux, meaning the symptoms I mentioned in the beginning, the heartburn, the nighttime cough, the sour taste, or whatever you have being properly diagnosed as acid reflux. Because remember, sometimes those symptoms can mimic other things. Some things that can actually be pretty, scary and dangerous, which is why you're going to see your doctor, right? So you can make sure you get that proper diagnosis. But should it be acid reflux, you might be able to help a lot of your symptoms by changing your diet. Talk about that's as natural as it comes. Many people, yes, do need to take medications, need to have further testing, need to have maybe further treatments. Don't get me wrong, but you can do a lot with diet. Now let's talk about some of the non-diet things that will help. And so Vernon, you jumped in and said a few things that I think were awesome. We're going to talk about, say, some of the non-dietary things that may help. And let's see here. All right, so let's talk about this. Some non-dietary things that may also help ease symptoms. And well, we already talked about dietary, so these are the non-dietary. Losing weight, huge, guys. Obesity actually puts us at risk for so many things, heart disease, et cetera. I posted that video earlier about heart disease. So many things we are put at risk for by obesity. But you know what? Losing weight can actually ease or improve acid reflux symptoms. Yeah. Note to self, if you were kind of trying to get on your post-pandemic workout plan schedule, trying to get back in shape or trying to eat better, be healthier, that's another reason to do that. Also, another thing, do not eat close to bedtime. Okay. So a big fattening heavy meal right before bedtime is a recipe for disaster, especially when it comes to things like acid reflux symptoms. Okay. So you don't want to eat close to bedtime. Along those lines, you don't want to eat large meals in general. Try to avoid large meals, but certainly large meals at bedtime is really not the way to go either. Okay. Also, some people find benefit from elevating the head of their bed. What that means is like you prop a couple pillows up so that you're not lying flat, okay, that there's a little bit of elevation. Many people find benefit from that. Also, keep in mind that some medications can maybe aggravate acid reflux symptoms. So if you feel like that might be you, this is something to go through your medication list and talk with your doctor about. And then also, one of you, or you guys have often said, quitting smoking can decrease acid reflux symptoms. Once again, if you are contemplating contemplating quitting smoking, I've done some videos on that. How to quit smoking, the benefits of quitting smoking. This is another reason to quit. Okay. And then also, what I have on this list is managing stress. Now, I know you're probably going to say, oh, those are all simple things. I mean, and I'm saying that facetiously, right? I mean, look, if losing weight was easy, we would all do it, lickety split. If quitting smoking was easy, nobody would have a smoking issue. Nobody would be smoking who didn't want to, right? If managing stress was easy, maybe there'd be a lot less acid reflux symptoms in the world. I understand that these things can be, I don't want to say tough or difficult because we're going to be motivational about this. I'm going to say, look, these things can be a challenge at times, okay? And take work and perseverance. But what I know is that we've gotten through COVID. And I know none of us thought that we are going to have to live through a pandemic in our lifetime. I know that you are strong. And that also plays a role when we talk about things like acid reflux. Take these things to heart, really. And remember that things like cutting out high fattening foods, fried foods, other foods that are unhealthy, which very likely alcohol, smoking, will help your acid reflux. It'll help your acid reflux, but it's also going to help the rest of your body as well. So, guys, let me take a few of your comments. It's so great to see you guys. Welcome. By the way, I'm Dr. Jen. For those of you who are just joining, I'm a practicing family physician and on-air health expert and video creator. Thank you guys for sending stars. You guys are rock stars. Look at you out there sending stars. I love it. It's good to see you guys. Lisa Peach. Lisa is one of my Dr. Jen superstars. By the way, consider joining one of my membership group on Facebook. That's my Dr. Jen Superstars group. You get all sorts of perks, even private lives every Wednesday. I usually do lives for them when I'm cooking dinner in the kitchen. Ruby, thank you so much for the stars. I appreciate you. Let's see here. Renee, you said my hair is awful. Well, I'm sorry. I'm just getting home from work. I see, I do read the comments. Sorry, just getting home from work. It's probably not the best. Let's see here. What else are you guys saying? Sugar Plum Plummy. That's your name. I think that's a beautiful name. You said bananas, ginger, and pears. Are those things that make your acid reflux worse? That's interesting. Let's see here. Danita, you said your son changed his diet and now he has less heartburn. So see, guys, it really, really can work. Okay. Let's see what else we got here. Let's see, Tracy, you take a medication for acid reflux that helps you. And remember, guys, once again, this is what we're saying is that, some of you may need to take medications. That's okay too, if that's what your doctor recommends. Okay. That's all right. You may even have to have other procedures or things going on. That's okay too. The idea is you want to do what's going to be right for your body. Okay. And what your doctor recommends based on your diagnosis. Just know that you may be able to improve a number of things by, how you function in your everyday life. Okay. Let's see here. What else we got? We've got a few people from Trinidad. I love it. Sherry, you're from Trinidad. Well, hello in Trinidad. It's so great to see you guys. Donna, you just got your COVID vaccine. Well, whoop, whoop. I love that. By the way, if you guys have not joined my group called I Got the COVID Vaccine, even though I'm not talking as much about COVID because things are calming down, please join the group. You'll be able to hear from other people who are getting the COVID vaccine. Just check out the pinned comment. You can join the group. I'll accept you right after this live. You can post pictures of yourself getting the vaccine. We can celebrate you, all that good stuff. Let's see here. Brenda, you take Zegrid. I see. Leslie, you've had an endoscopy. Okay. Cucumbers. Anju, you're wondering about cucumbers. Well, that's not on the list. My guess would be that cucumbers probably would be okay, but you have to see how you do with cucumbers. Remember, sometimes it's funny. Sometimes acid reflux pops up in different people in different ways, so you want to sort of pay attention to that. But remember, guys, this is another sort of, little tip, little tricks and tips that you can have in your back pocket for ways to not only get healthier, but hopefully manage acid reflux symptoms. If your doctor has already diagnosed you with acid reflux, I hope these will help. Make sure you talk to your doctor about what I'm telling you to make sure that it applies to you. But if you do a Google search, you look at, whether it's medlineplus.gov, by the way, it's one of my favorite websites to search for medical information, or Cleveland Clinic or what have you, you will find these suggestions. So I hope that they help you. Guys, I do videos on ways that you can live a healthy life, talking about all sorts of topics. So I so appreciate you. I love you guys being here. It means the world to me. And I love your comments. So let me know how you're doing and what's going on in your lives and what topics you want to hear about. If you've not liked and followed my page, please do. Make sure you get notifications so you can see when I go live, which, by the way, is every Monday and like Friday-ish or so. Monday, Thursday, or Saturday, something like that. Monday, definitely. Okay, I'm botching this up by now. Every Monday, definitively. And then either like Thursday or Saturday, depending on how the week is going. So just make sure you do that. Guys, you're amazing. Let me know in the comments what you do to stay healthy and how you manage your acid reflux. Thank you for the stars. I love you all so much. Hope you guys have an amazing night. Bye. Bye, YouTube.